Hey, how you doing? My name is Derek, and I'm delighted to be here and proud to be here as part of the Future Trials launch. So thanks to Martin and Peter, and especially Fidelma for her leadership in the Diabetes Collaborative Clinical Trials Network. So I'm here talking about technology because I'm a physicianeer. So that means I trained originally as an engineer. So I did electronic engineering, computer engineering, then biomedical engineering, and then did medicine, and then trained in that. So when I finally got a permanent job in 2018, my father cried. He was so happy I got a permanent job after 20 years of college. But that gives me a unique insight into being a consultant physician, so being at the bedside with patients, but then also being interested in technology and work in the laboratory. So the clinical team across the road here, we're co-located. It's a fantastic campus. We see patients with diabetes and we try and help them every day. And then when I started in 2018, I set up a hive lab. So in the same principle of the philosophy you've been hearing today about the importance of collaboration, no one honeybee makes honey. So you need to have a hive. So in our hive, we have this collaborative approach between computer scientists, educationalists, psychologists, physicians, and HSCPs. And we try and do some innovative projects in diabetes technology. Too many to mention here in the 7 minutes, but our wide range from robots to drones to optimizing insulin pumps. And a lot of that is around the diabetes technology. So how can we use the diabetes technology to improve patient outcomes? So we don't want to just use technology for the sake of it. We want to make sure that there's good clinical outcomes for patients at the end of it. And a lot of this work has gone mainstream. And we know this because if you look at the media, this picture, so this can be a bit confusing when you first see this picture. This picture is 2021, the former President Donald Trump. And bear with me, there's been a few UK Prime Ministers, but 3 Prime Ministers ago, this is Prime Minister Theresa May. And when this picture came out, everyone's eyes went to her left arm. And they saw that thing on her arm, that piece of electronics, and they said, MI5 tracks UK Prime Minister. Bond on the case. But anyone who's in the world of med tech knows that's a continuous glucose monitor. And Theresa May has been one of the great advocates for type 1 diabetes, usually a disease of early life. She actually developed it in her early 50s as an MP and then went on and became the UK Prime Minister. So a great advocate for not being defined by your chronic disease, but rather living well with it. And I said it's gone mainstream, the technology, which is really important. So for those who watched the Super Bowl this year, if you stayed up late, this was one of the Super Bowl ads.
This small thing is the next big thing.
I wanna make it go up.
And when I make it go, wow.
The all-new Dexcom G7 for all types of diabetes. It shows your glucose, predicts where it's headed, and tracks your success, just like that. Not magic, just feels that way. Dexcom, powerful, simple diabetes management.
So that's Nick Jonas. If you know who Nick Jonas is, that means you're under 30. And that shows it's gone mainstream. It's gone to a Super Bowl ad. And I have no disclosures for any of the companies that I speak about today. But Dexcom recently just launched 1,000 jobs here in Galway 2 weeks ago. So we really are in an amazing medtech ecosystem. We're the Silicon Valley of medtech with 14 of the world's top 15 medtech companies in Galway and 10 out of the top 10 ICT companies in Ireland. So we're at this great point of technology and clinical medicine combining. In Ireland, I'm the National Clinical Director for Diabetes, and we can offer patients 4 different choices of continuous glucose monitors. And the question is, which one do you actually offer the patient? Well, you actually have to go and look at tables. The Diabetes Clinical Trial Network in the UK, Diabetes Technology Network in the UK, they produce these helpful tables to compare differences across the different CGMs. And what you have to remember is everyone who graduated from medical school 5 years ago in 2018, none of them learnt about these devices in their medical degree. So all this has happened since that, and it shows the importance of staying up to date and continuing learning in medicine and in clinical practice. You can't just say, I didn't learn it in medical school. You have to stay up to date. And it's the same with the insulin pump. So in Ireland, we offer insulin pumps for patients with type 1 diabetes. And again, there's a choice of 3. So again, you need to know which one to offer the particular patient in front of you. And again, you can learn about the different pumps and you can decide which is best for your patient. Now, the challenge with the continuous glucose monitor, for example, that piece of technology I showed you, is that rather than patients pricking their finger 5 times a day, which is very difficult to do over your lifetime. And don't forget, as clinicians, we see patients, if you added up all the hours a patient sees me during the year and the rest of the clinical team and their GP and so on, it's probably 9 hours a year. Okay, but this is a chronic disease, and how many hours are in the year? There's 9,000 hours in the year. So for the vast majority of the time, they need to look after the disease themselves. But with that CGM getting 300 values a day rather than the 5 blood sugar values, we end up in a situation of having all this data to analyze when they come to clinic. And a problem with that is there's so much data, sometimes it can feel like you're drinking from a fire hose. And that what's really important from computer science then is to take that data and abstract it up the levels to wisdom to get that insight. And the different glucometer companies came together a few years ago and standardized the format of reporting called the AGP. And we use this now every day at clinic across diabetes. And what's really interesting again is that we now teach the final med students about this. So just as we have modules on how to read an ECG and a lecture on how to read an X-ray, we give them lectures on how to read AGPs. So they're graduating now with this kind of knowledge. And again, it's important for the clinicians who've trained already to upskill in this. So the next thing I want to show you is this gentleman. His name is Sundar Pichai, and hopefully you know who he is. He's always smiling. And he smiles for 2 reasons. One, he really loves what he does. And the other reason, he's one of the richest people in the world. And if you don't know who he is the CEO of Google, or Alphabet. So he's in your pocket right now. And he has a great name because AI is actually in his name. And this is a really important part of where medtech is going. And he gave a talk last week for 10 minutes, which I can't play for you, but I took 10 seconds out of that 10-minute talk to tell you what's on Google's mind.
AI, generative AI, generative AI, generative AI, AI as AI, AI. It uses AI to bring AI.
So you can see where it's going with medtech that's going to be used for patient care. It's about developing AI-based systems to give us new insights into clinical data. And the best example of that I just shared with you is new insights into looking at that CGM and prompting patients to make those corrections before they see the clinicians those 9 hours a year. So then another example of AI is something like when we ask patients who are obese to calorie count, or people who have type 1 diabetes to carb count. The idea of, traditionally we teach patients how to do it using books or maybe using apps, but the new way of doing it is using AI. So just to finish on this then, so another example of what we're doing here in Galway, we've just launched a trial using AI avatars as a surrogate for healthcare professionals to educate patients about their medication use. So we'll see how that works. Oh, it doesn't work either. Oh, here we go.
Hi, I'm Viola. I'm excited to show you the results of our game-changing research into humanizing AI. Autonomous animation enables digital people like me to take input from the environment and respond in real time. We've now significantly enhanced my ability to respond emotionally, give great eye contact, and react to my changing environment. This makes for a truly engaging interaction. I was made in the groundbreaking digital DNA blender and effortlessly launched using our ddNA Studio with only a few clicks. My identity and personality were crafted by blending features like skin texture and tone, face shape, eye color, voice, language, and of course, hair. Now, in minutes, anyone can create a unique, high-quality digital person that embodies the soul of a brand. And they can do it using the most advanced AI, CGI, and autonomous animation technology in the market today.
So we've trained the AI to teach patients about medications such as GLP-1s. And the idea is there's an 18 million shortfall of healthcare workers by 2030. We just don't have the throughput or the capacity of healthcare professionals coming through to be there for the patients who have chronic diseases. So we're looking at new ways now in this trial of using avatars to do that. So I'll finish there. I just wanted to say there's an awful lot happening with technology. And for those who need to upskill, we've just launched a digital health and telemedicine course for free, available to everyone who wants to upskill through the RCPI. It's available online. Thank you.